Good afternoon, everyone. My name is Campbell-Young, and today I'm going to be talking about the importance of intuition in emergency medicine. Intuition has seldom been granted legitimacy as a sound approach to clinical judgment in medicine. Instead, it has been viewed as the basis for irrational acts, guessing, or even as unfounded knowledge. And yet, through my own experience, I have seen that intuition can in fact play a vital role in clinical judgment, especially in an emergency department. Let me give you an example. When you arrive in accident emergency, your first port of call is triage. This is where an expert nurse or doctor prioritizes patients with regards to their degree of urgency. Now imagine you're working in triage and you receive a young boy who has fallen from his bike and is complaining of a sore arm. If you view the situation logically, you'd think that he's probably just got a minor injury, possibly a fractured arm. But for some reason, you have an overwhelming feeling, call it a gut feeling if you will, that this boy's life is in fact in danger, and this is not just a minor injury, but a vital emergency. What would you do in this situation? If I told you that this boy got admitted to A&E and was diagnosed with, yes, a fractured arm, but due to further testing was also diagnosed with a fractured spleen, and was in fact suffering from internal bleeding. If you decided to let him wait outside in the waiting area, he could have gone into hypovolemic shock through his internal bleeding and could have in fact died. These sorts of situations is what got me interested in intuition in the first place. And when I started to talk to expert nurses and doctors who had worked in triage, they could all give me key examples of when they too themselves had experienced this phenomenon. These professionals took vital steps towards saving their patients' lives by listening to their gut feelings. Call it their intuition, if you will. And yet, intuition has a controversial place in medicine today, and that's for two reasons. The first is due to the models of clinical reasoning that we use, and the second is due to the definition of intuition in itself. If we look at the models of clinical decision-making in medicine, we have two broad ways of thinking. We have analytical, and we have non-analytical. If you look at analytical first, it's logical and objective. It's your classic linear way of reasoning where x plus y equals z. In medicine, we take x plus y, we plug in signs and symptoms, and out comes a diagnosis, or in the case of this situation, a triage decision. Non-analytical is everything that analytical isn't. It's subjective and it's automatic, which means we have unknown factors combining to give a diagnosis or a triage decision. Obviously, in evidence-based medicine, we want to be working more towards an analytical model of reasoning and steer away from everything which is non-analytical. And yet, when we consider intuition, we have a problem because intuition would tend to come up with this broad heading of non-analytical reasoning. And this is why it is viewed so controversially. But what is intuition? If asked yourselves, what does intuition mean to you? Some of you may talk about thinking with their feelings. I've already mentioned the term gut feeling. You may think about irrational thought. Some of you may even mention reasoning with your emotions or unfounded knowledge. And yet, through my research, I've found that there is one term which is almost used synonymously with intuition, and that term is instinct. But today I want to make one thing clear, and that is that intuition does not equal instinct. Instinct is innate knowledge or behavior. It's what we're born with, and it's in our genes, and it's mostly used when describing animal behavior models. Intuition, on the other hand, is the formation of ideas via a reasoning which is not perceived by the conscious and can in fact be considered a learnt process. If we take this definition and break it down a little bit, if something is not perceived by the conscious, it must therefore be subconscious, and that would explain why we're not aware of what's going on. And this concept of subconscious has sparked quite a lot of research recently in the realms of mostly neuroscience and psychology, and what they've found is that the conscious mind can process about 40 bits of information per second, whereas the subconscious can process about 10 million bits of information per second. So we see that the subconscious may in fact be the driving force behind the decisions that we are making in everyday life. But where does the subconscious get this information from? Well, it can be linked to experience and therefore to expertise. As we go through life, we experience a number of different situations, and these experiences become impregnated in our subconscious as memories. As we meet a new situation, our subconscious can access these memories and use this information to make a decision about what would be the best, how to proceed in this actual situation. And this, if we were to think of that, if our conscious mind would try to access all these memories, all these experiences at once, it would simply become overwhelmed because it can only process a small amount of information compared to the subconscious, and we would not be able to function or make a decision. And this concept of experience can be directly related to expertise, because the more experience we have in a certain area, the more we become an expert in it. If you immerse yourself in a certain field of practice, or if you study really hard at something, then you will eventually become an expert in it. And in medicine, this has been shown by the fact that expert nurses with a greater number of years' experience are more adept at using intuitive reasoning models than their novice or beginner colleagues with fewer years of experience. So now that we've got an idea of the concept of intuition as a learned process, learning from our experiences, and have distinguished it from unfounded knowledge, innate knowledge, when we see the term instinct, we can start to understand intuition as a concept which is more inviting to evidence-based medicine, and we can start to think about how intuition can be used in the models of clinical reasoning that we use, and also how this can be applied pragmatically in an emergency department. If I bring up the models of clinical decision-making which I described earlier, but for the basis of the emergency department, I want to think about triage decision-making instead of clinical decision-making. If you think about that situation I explained to you with the boy with the fractured arm, and we go through analytical reasoning, we see that objectively and logically, we'd be, when looking at his signs and symptoms, we'd believe that it's simply a fractured arm and would therefore be a low triage priority. Now let's look at non-analytical. But instead of using this broad term non-analytical, let's think more about intuitive reasoning. Intuitive is still subjective, but we know why it's subjective. It's because our subconscious is using our own personal expertise and experience to reason. And yes, it's automatic, but this can also be thought of as being pretty much immediate. And that, of course, means that it's extremely fast. And I hope you can appreciate that this would be extremely advantageous in an emergency situation. If you think about the example I gave at the start with the boy with the broken arm, our intuitive reasoning was telling us that this was a high triage priority. And as I explained, if you were to follow an analytical model of reasoning, you may ask this patient to wait outside in the waiting area, where he could continue to have internal bleeding, go into hypovolemic shock, and left untreated, could eventually die. So we see our analytical model is failing this patient, whereas our intuitive model is meaning that this patient is getting admitted immediately, getting tests done, and getting the life-saving surgery that he needs. So we see, although that the analytical model can be trusted 99% of the time, our intuition is acting like a safety net for this small amount of cases. Intuition is therefore what distinguishes expert human judgment from the simple computations that might be made by a novice or beginner in a machine-like manner who is simply following an analytical model of reasoning. In medicine, we need to start considering intuition not as a controversy, but as a tool for our clinicians on the ground, especially in triage and in emergency departments, because it can, in fact, save lives. Thank you very much.